You made it home from the dentist. The numbness is finally fading, and then you feel it. That deep radiating ache starts to build in your jaw. It's a soreness that threatens to lock everything up and make a simple yawn feel like a big mistake and turning your next meal into something you're already dreading. You just spent an hour, maybe longer, with your mouth stretched wide open, and now your jaw muscles are screaming about it. Before that ache blossoms into a full-blown throb that kills the rest of your day, what if I told you there's a simple 15-minute sequence you can do right now to stop it in its tracks? No special equipment needed. All you need are two things you definitely have at home and a little bit of your time. I'm going to walk you through a gentle, follow-along routine that will relax those angry jaw muscles and help you feel normal again. Stick with me, and in 15 minutes, that post-dentist soreness will feel like a distant memory. First, let's quickly get into what's actually happening. That soreness isn't just in your head, it's very real. Your jaw joint, the TMJ, and the muscles around it are incredibly complex. During a dental visit, you have to hold your mouth open for a long time, and sometimes that position is just plain awkward. Holding that position fatigues your jaw muscles, much like holding a heavy weight at the gym for too long. Eventually, the muscles get exhausted, inflamed, and sore. The good news is we can counteract this with a simple, powerful technique, alternating temperature therapy. And that's where our two household items come in. Go and grab two things for me. First, find something cold. An ice pack or a bag of frozen peas wrapped in a thin towel will work perfectly. Second, get something that can hold gentle, moist heat, like a clean washcloth and a hot water bottle. That's it. These are your tools. Now, a quick but important note. This cold then heat routine is designed for the muscular ache you get after a routine work like cleaning or a filling. If you just had oral surgery, like an extraction or an implant, your dentist likely recommended cold only for the first 24 to 48 hours to control swelling. Always stick to your dentist's specific post-op instructions. For muscle soreness, here's why this works so well. The cold compress is our first move. It constricts blood vessels, which immediately dials down inflammation and swelling. It also acts like a natural anesthetic, numbing the area to give you fast relief from that initial sharp ache. Then, once we've calmed things down, we bring in the moist heat. Warmth does the opposite. It boosts circulation, brings in fresh oxygen to the muscle tissues, and helps them heal. It soothes and relaxes the muscle fibers, melting away that stiff, locked-up feeling. This 1-2 punch of cold then heat is a fantastic technique for this kind of acute muscle soreness. So if you got your cold pack and your washcloth ready, let's get started. Find a comfortable spot to sit or lie down where you can relax for the next 15 minutes without being interrupted. Let's get you some relief. All right, let's start the clock. We're going to move through this together, step by step. Don't rush. Just follow along and focus on letting that tension go. Let's start with your cold pack. Make sure it's wrapped in a thin cloth, like a dish towel or a t-shirt. You never want to put a frozen pack directly on your skin. Now, gently place it right onto the sorest part of your jaw. It might be on one side, or maybe both sides are tender. If it's both, you can either switch sides to sides every minute, or use two packs if you have them. Close your eyes and just hold it there. Take a slow, deep breath in through your nose and a long, slow breath out through your mouth. For this first minute, your only job is to breathe and let the cold begin to do its work. You'll start to feel a dulling sensation as the cold seeps into the muscle. That's the numbing effect kicking in. It's your friend. It's interrupting the pain signals your jaw is sending to your brain. As we move into the second and third minutes, scan the rest of your body for tension. Let your shoulders drop and clench your fists. We tend to hold stress everywhere else when one part of us hurts. So consciously let everything go soft. Think of the cold as actively calming down those irritated muscles, telling them the stress is over and it's time to recover. We'll hold this for about 5 minutes total. It might feel pretty intense at first, but it should soon become a comfortable, dull cold. If it ever feels like it's burning or is just too much, add another layer of cloth or take it off for a few seconds. Listen to your body. You're in control. Let's just take one more minute here, letting that therapeutic cold sink in. Okay, you can gently remove the cold pack and set it aside. Your skin might be a little pink, which is totally normal. For the next minute or two, we're just going to rest and reset. I want you to focus on the single most important habit for jaw health, finding your jaw's natural resting position. Gently let your lips touch, but keep your teeth slightly apart. Let your tongue rest lightly on the roof of your mouth, right behind your top front teeth. This lips together, teeth apart posture is the ultimate chill out state for your jaw. So many of us, especially when we're stressed or in pain, clench our teeth without even realizing it. That keeps the muscles constantly firing. So right now, just consciously hold that relaxed position. Lips together, teeth apart, tongue resting up. Take another deep breath in, and as you breathe out, feel your jaw muscles go completely slack. Let it feel heavy and loose. This moment of mindful relaxation is just as important as the temperature therapy. You're retraining your muscles how to let go. Now it's time for warmth. Take your washcloth and rub it under warm, not scalding water. Wring it out so it's damp but not drippy. Same with the hot water bottle. We're not using boiling water, just warm. Place the warm, moist cloth over the same spot you just had the cold pack. That should feel amazing. Where the cold numbed and reduced inflammation, this moist heat is all about soothing and increasing blood flow. That fresh circulation helps flush out the cells from the tired muscles and brings in oxygen. They need to heal and relax. Lean back, close your eyes, and just melt into this feeling. Imagine the warmth penetrating deep into the muscle fibers, encouraging them to release and to lengthen. This is the part of the routine that really tackles the stiffness. If your jaw was feeling tight, this should help it feel more pliant and soft. While you're enjoying this, let's quickly talk about the next 24 hours. The best thing you can do is give your jaw a break. That means sticking to soft foods. Think soups, smoothies, yogurt, mashed potatoes, scrambled eggs. Avoid anything hard, crunchy, or chewy. No tough bread, no crunchy nuts, and definitely no chewing gum. Chewing on tough foods right now is like trying to run on a sprained ankle. It will only set you back. Be kind to your jaw for a day or two. Let's hold the heat for one more minute. All right, go ahead and remove the warm cloth. Your jaw should feel much more relaxed and warm, ready for some very gentle movement. When you're sore, it's tempting to keep your jaw perfectly still, but that can lead to just more stiffness. These super gentle stretches will help restore mobility. The key word here, gentle. Nothing should cause sharp pain. First, the slow, controlled opening. Keep your jaw relaxed. Slowly open your mouth as far as you can without any pain. It might not be very far, and that's okay. Go to the edge of comfort and hold it for a count of 3. 1, 2, 3. Now, just as slowly, close your mouth. Let's do that 4 more times. Slowly open, hold, slowly close. We're just reminding your jaw about its safe range of motion. Next, the gentle side-to-side glide. Return to that relaxed position with your teeth slightly apart. Now, very slowly, glide your lower jaw to the right. It's a tiny movement. Don't force it. Hold it for 3. Come back to the center. Now glide it to the left. Hold it for 3 and back to center. Let's do that 2 more times on each side. Glide to the right. Hold. Back to center. Glide to the left. Hold. Back to center. Glide to the right, hold, back to center. Glide to the left, hold, back to center. This gently works the muscles on the side of your face. And that's it. You've just completed the 15-minute sequence. Take a second and just notice how you feel. That sharp edge of pain should be gone. The stiffness should be better. And your jaw should feel significantly more relaxed. You now have the main tool to manage this discomfort. You can and should repeat this entire cold to heat to stretch routine a few times today and tomorrow if you feel that soreness starting to creep back in. But please listen to your body. Well, this is fantastic for typical muscle soreness if your pain is severe, getting worse, or doesn't improve after a day or two. It's time to call your dentist. Persistent or worsening pain could be a sign of something else going on that needs professional attention. Remember the keys to recovery for the next day or two. First, stick to that soft food diet to give your muscles a real breather. Second, pay attention to your jaw posture. Check in with yourself. Are my teeth apart? Is my tongue resting on the roof of my mouth? This stops you from unconsciously clenching. And finally, if your dentist gave you the okay, an over-the-counter anti-inflammatory like ibuprofen can help with any lingering discomfort. If you want a more detailed look at applying heat and ways to apply it, check out this video here. And there you have it. You just took control of your own relief instead of just waiting around to see if maybe the pain will go away. Your jaw should be feeling much better. This simple 15-minute trick is your secret weapon for post-dental visit soreness. Thanks for taking this time for yourself, and here's to a pain-free rest of your day.